Hello, good morning. How may I help you?
Hello? Dr. Peralta? This is you, right? I'm your patient before. I'm worried about my condition now. Please do assess my situation, please.
Yes, I am Dr. Luella Peralta. Before anything else, can I ask your full name, age, so I can check your record file? And please state your main concern for seeing me today.
I'm Krizia Cari-an, 30 years old. I work as a janitor at SWU Medical Center. I'm very worried now because the common signs and symptoms of COVID-19 that I heard in the news are likely the same with my condition. I am very worried that I might be able to infect my children and cannot be able to work again because of the sickness and won't be able to support my family.
Have you had any thoughts about what it might be?
Because of the rising cases of COVID, I am worried that I might have it.
Mrs. Cari-an, please calm down. I do understand your situation. I know you are having a hard time and all that is happening. Please, can you tell me exactly what are your main concerns?
Doctor, I have a cough, fever, sore throat, and I have a problem with my sense of smell. This is alarming me so much.
Rest assured, we will look into your concerns thoroughly together, Mrs. Cari-an. I would like for you to check your temperature today. Do you have any thermometer around your home?
Yes, Doc.
What were you hoping that I might be able to do for you today? Would you like any laboratory procedures done or any medications to relieve your symptoms?
By any means, Doc, please help me with my condition now.
What is your temperature?
Today, my body temperature is 38.5 Celsius.
Noted. Thank you. How long did you have all these symptoms? Can you tell me exactly how the symptoms started?
About 3 weeks now, Doc. It's just after my shift at the hospital. I am feeling my throat. Then, I lost sense of smell. After that, I had a cough and fever.
Tell me a little bit more about the feeling you have in your throat.
It feels dry.
Are the symptoms the first episode or did it have multiple episodes?
It only happened last 3 weeks ago, Doc. I only had the same symptoms until now.
Has there been any improvements with your cough or has it worsened?
After a week, it became worse than I thought.
Can you tell me about your cough? Is it dry? Do you have any phlegm? Does coughing leave you out of breath?
It is a dry, persistent, and I don't produce any phlegm when coughing, and it leaves me short of breath also.
Do you have any colds, fatigue, or flu-like symptoms?
Yes, Doc. That's why I lost my sense of smell. I have tiredness all over my body that I can't even explain.
Do you have any trouble breathing? Can you describe it?
Yes, Doc. Sometimes I am having shortness of breath.
Is there anything that triggers your cough or sore throat?
When I'm having cold drinks or sweet food, my sore throat gets worse. In coughing, whenever I drink hot or lukewarm water, and it feels nice, then I stop coughing.
Have you had the same conditions as before or asthma?
No, Doc. I usually don't get sick easily, but if I do, a good night's rest or just taking paracetamol or bioflu can treat me right away.
Have you had any recurrent chest infections, cardiac or respiratory conditions?
None, Doc.
Do you have any close encounters with people with fever, cough, etc.?
Yes, Doc. I'm working in the hospital, so most of the time, whenever I clean in ER or wards, I can encounter a lot of sick patients.
Aside from your workplace, can you tell me if you have traveled to any other place, domestic or international recently?
No, Doc. Doc, excuse me. Sorry, Doc.
It's okay. Have you had any disease that can cause immunosuppression or weaken your immunity, such as chronic kidney disease, heart failure, HIV, or others?
As far as I know, I don't have any of that diseases.
Have you been taking immunosuppressants for rheumatoid arthritis?
No, I haven't.
Have you undergone any previous tests such as chest x-ray? What were the results of the tests performed?
I had a medical checkup annually as a requirement in our work. Last year's laboratory test and x-ray showed normal results.
Okay, noted. Have you taken any medications?
Only paracetamol and Tuceran for the past days.
Have you ever taken angiotensin converting enzyme inhibitors or ACE inhibitors?
No.
I checked your record, then I saw that the last you had checked up was last year because of your urinary tract infection. Have you had any condition or sickness after our follow-up checkup?
I only had fever or flu, Doc, maybe once or twice after that.
Have you been taking inhalers like steroid inhalers? Have you had any other antibiotics prescribed to you for continuous usage in a certain period of time?
I have been treated with ciprofloxacin, I guess last year with my UTI. I haven't used any inhalers.
What has the effect of the medications been? Has it totally relieved their symptoms, or has it made any difference in any way?
Paracetamol was okay. It lowers my fever, but the cough medicine doesn't have any alleviating effects on me.
Have you ever smoked?
No.
Tell me about your use of alcohol.
I don't drink alcohol, Doc. I just drink light beverages during special occasions.
How about recreational drugs? Have you used recreational drugs such as marijuana, shabu, ecstasy, and so on?
No.
Tell me about your occupation. Are you exposed to particular chemicals such as dust or asbestos?
I'm a janitress in the hospital, so I am mainly exposed to patients and hospitals' infectious waste.
Do you have a pet bird?
None.
What are your hobbies, or what do you like to do during your free time?
Nothing in particular. I just go to grocery stores or buy something in the public market.
Does your present condition limit your ability to self-care or perform your tasks comfortably in the hospital?
Yes. I haven't gone to work since I was continually having fever, fatigue, and cough.
Has your family had any history of asthma or atopy?
No, my family does not have any history of asthma. I'm not familiar with the term atopy. Can you explain to me what it is?
Okay, so atopy is the genetic tendency of a person to develop genetic diseases. These could be hay fever, food allergies, or eczema.
No, Doc.
What about cystic fibrosis, lung cancer, or any lung conditions in general?
None, Doc.
Aside from cough and sore throat, what other problems in the respiratory tract do you have as of now?
Yes, Doc. I had lost my sense of smell only.
Are you experiencing any chest pain?
None, Doc.
Do you have any concerns in your abdominal area?
None, Doc.
Have you had any headaches recently?
As of now, no. None, Doc.
Is there anything that you are particularly worried about? I would like to make certain that I have addressed it during this consultation.
Nothing. I had already brought up all my concerns, Doc.
Okay, that's good to hear. Thank you for your time. Take care. Goodbye.
Thank you, Doc.